Welcome back. You've probably seen a lot of predictions for our area when the virus will peak here, and there are a lot of different models on just that. Our national investigative team looks at the sometimes wild discrepancies. Here's Investigate TV's Lee Zurich with our COVID-19 tracker.
Right now, one model estimates coronavirus will cause the state of Wisconsin to have 3,000 deaths. Another projects 357. About a week ago, this model projected the state of Mississippi would run out of ICU beds. Now it estimates the state will not, with no clear explanation of when or why that model changed.
It would be good for the modelers to explain why have we changed our story? Is it because we've discovered a flaw in our model, or because the world has changed? That is, if people are social distancing and people are getting sick at a slower pace.
The coronavirus crisis has introduced many Americans to these models.
In normal times, you would not get the models direct. The models would not go directly from the scientists to the public. They would go through rigorous peer review. You'd submit it to a journal. 90% of the papers submitted to good journals get rejected. If they get accepted, you've gone through maybe 2 or 3 rounds of being beaten up.
We analyzed the 2 popular models, COVID Act Now and one from the University of Washington. We found the predictions for the days states will peak are on average 53 days apart.
If these models are being used not just to inform the scientific community, but to inform people like you and me who have to figure out how to run our lives, and then they have a duty to explain what those differences are.
The models have helped government leaders prepare hospitals and prepare citizens.
One of the things that I think that they've done well, and I think has been communicated well, is to understand how effective social distancing can, as they say, flatten the curve so that we don't overwhelm our hospitals.
Our COVID-19 tracker map keeps track of the total number of cases in every county. The darker the colors, the more cases per capita. Here's the map 2 weeks ago, a week ago, and now today. One more look, 2 weeks ago, then a week ago, and then today. You can see several areas that are much darker. The comparison shows a significant expansion of cases in the New York City area. Dark areas go down to Philadelphia and up to Boston. Other areas that have seen significant spread in the last week, Indiana, Southwest Georgia, and the state of Mississippi, where positive cases have doubled in the past week.
You can check out those county maps and check out the data yourself on the VNL News app. Up next, making the best out of our current situation, how you can visit the animals at one zoo without actually going to the zoo.